Any discomfort?
It's a little bit of that shooting pain down the scapula now.
Here?
Exactly,
Okay.
yes.
Any discomfort in the neck?
It pulls quite a bit, just from like yes.
Across here. When I do that, any discomfort in the neck?
Yeah, that's quite a lot
Is it
down there.
pinching?
Yes.
Yeah? Okay.
Yes.
So you can feel that it's a little bit weaker, right?
Absolutely.
Hold for me.
Oh yeah, that feels very weak.
Yeah?
Yeah.
Okay. Let's get you to raise your right leg for me, please. And down. Okay. Relax. Here a bit. Here you're quite jammed. You can see there's a nice juicy trigger point. And exhale. Inhale and exhale. Inhale. Okay, so when you try to stretch that trap, it's effective for a period of time, but it's the sensitivity of the nerve that's keeping you in that cycle. How does that feel?
Much better.
Yeah. Can you bend forward? I'm going to push forward. I want you to resist for me. Let's go. There we go. Go, 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 go. Much better. Okay. Lift up. Hold for me. I'm going to push forward. Resist. Go, 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 go. There we go. All right. Let's get you to raise your right leg from your hip for me. Fantastic. And down. Left leg. Up, up, up. What's up, everybody? Dr. Ranen here. Today we have Juandre Kruger with us. Juandre is an ex-professional rugby player from South Africa. He's currently a personal coach based in Dubai and a bodybuilding enthusiast, according to him. Juandre plays cricket and he's been having some right-sided neck and shoulder pain. So we're going to perform a general spinal screen and we're also going to have a look at that right shoulder. All right, let's get going.
Sounds good. Thank you, Doc.
Guys, don't forget to like, subscribe, and hit the notification button. Okay, let's go. Oops, okay. Let's check this out. There we go. Okay. Leave your leg loose for me. Can I get you to cross your fingers for me, please?
Sure.
Pull apart and look up. Okay. Relax. You can relax. Can you feel this?
Yes.
Same both sides?
Yes.
Here? Same
Yes.
both sides? Here?
Yes.
Okay. Here?
Yes.
Here?
Yes.
Here?
Yes.
Here? Here? Same?
Yes.
Okay. Can you feel this?
Yes.
Same both sides? Here?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
Here? Same. Okay.
Yes.
Let's get you to lift your toes up for me, please. Hold. I'm going to push down. I just want you to resist. Great. Hold for me. Great. Bend your toes down. Hold for me. Great. Hold for me. Great. Okay. Let's get you to turn over. Squeeze. Squeeze, squeeze, squeeze. Good. Turn your hands over. Lift your fingers up for me, please. I'm going to push down. I want you to resist. Okay. Much weaker on the right side, eh?
Yes.
All right.
Definitely.
I just want you to squeeze for me again. Squeeze. Okay, good. Turn your hands over. Make a fist. Lift your wrist up. Hold for me. I'm going to push down. I want you to resist. Good. I'm going to push down. I want you to resist. Yeah. Turn over. Lift your wrist up for me. I want you to resist. Good. Resist. Okay, good. All right, make a fist for me. I'm going to turn over. I want you to resist.
Okay.
Good. Turn in for me. Good. Okay. Turn over. That way for me. Yeah.
Right. Okay.
You're struggling.
And
eh?
it's quite like
A
a
bit sensitive.
bit of a shooting pain there.
Okay.
Yes.
Turn in for me.
That's okay.
Turn in for me. Yeah, you've got way more power on that side compared to
Yeah, I
this.
can
You can
feel
see
that.
how you cock the wrist here. See, in order to get
Yeah, and there's immediate feedback on that.
your lateral
elbow.
epicondyle.
Exactly,
Yeah?
yeah. I felt
Okay.
it immediately.
Okay, hold for me. I'm going to push down. I want you to resist.
Okay.
Good, relax. Hold for me. I'm going to push down. I want you to resist. Good. Hold for me. I want you to resist. I'm going to push up. Good.
Okay.
Hold for me. I'm going to push down. I want you to resist. Good. Again. Good. Any sensitivity in the elbow?
That's okay in that position.
Okay.
No,
Hold
that's
for
fine.
me. I'm going to push up. Okay. Relax. Okay. Let's get you to stand for me, please. You're going to face that way.
Okay.
So I always like to start with a neurologic examination. The reason being, even though a patient may not present with neurologic symptoms such as numbness, tingling, pins and needles, we still want to assess the nervous system to see if there's any deficiency in it. As you can see with Juandre, if we hadn't muscle tested him, we wouldn't know that there's deficiency at that specific level. Let's get you to... Any pain here?
That's fine.
Okay.
No.
Here.
That's okay.
Good. Here.
That's okay.
Here. Good.
All good, yes.
Here.
All
Good.
good.
Let's get you to bend forward for me, please.
So more like a hinge.
Yes.
Okay.
Any pain in the lower back or stretching in the leg?
Not at
No?
all.
All right, let's get you to sit for me.
Sure.
Can you straighten your right leg for me, please? Point your toes towards you, chin down, slouch forward. Any discomfort in the lower back or stretching in the leg?
Just on the hamstring,
Hamstring.
but not on the lower back.
Left leg for me, please. Toes towards you, chin down, slouch forward. Any discomfort in the lower back or stretching in the leg?
Just to stretch on the hamstring again.
Same both sides.
A little bit more on the left.
A little more on the left.
Yeah.
Okay.
By the first test there, yes.
Okay, let's get you to cross your arms for me, please. Hug yourself.
Okay.
Okay. Let's get you to twist your shoulders to the right.
Okay.
That's pretty good. To the left, please. That's pretty good. Okay. Bend to the left for me, please. Any discomfort in the lower back, mid back?
That's fine.
Okay. To the right. Any discomfort?
None at
No,
all.
okay.
That's fine.
Interlace your fingers for me, please, and place them behind your head. There we go. Bring your elbows together. Bend forward for me. Okay. Now open up and open your elbows up. Sit up and open your elbows up. As far as you can go. Any discomfort in the mid back?
No.
Nothing
a little bit
at
of a
all.
squeeze, but no discomfort.
Where about?
Right in the mid back there, where you're
In
not.
this area here?
Yes.
Okay.
But just like a contraction, not pain or anything. Yeah. Almost a crampy sort of feeling. That's fine.
It's been a while since we've seen you, eh?
It's been ages. Yeah. Probably over 6 months. Yeah.
Okay.
The previous work that you did worked well, which is a good sign.
Bring your shoulders together. Okay. This is a big guy. Leave your body loose here. Sensitive?
No, that's fine.
What about down here?
That's okay. It's a little more sensitive, but no discomfort.
Okay. All right. And you relax for me. Okay, let's have a look at your neck. Can you look up for me, please?
Sure.
Any discomfort in the neck?
That's fine when I look up.
Look straight ahead for me. Can you turn your head to the left for me? Any discomfort?
That's fine.
No. Can you turn your head to the right? Any discomfort?
It's a little bit of that shooting pain down the scapula now.
Here.
Exactly,
Okay.
yes.
Look straight ahead for me. Bend your left ear to your left shoulder.
Okay.
Any discomfort in the neck?
It pulls quite a bit, just from like the yes. from
Across
the-
here. Right ear to right shoulder. You don't have much range of motion on that side, eh?
No, it's like I'm kind of resisting it a bit, yeah.
Okay. Relax for me.
It's on that edge of
Let's have a look
pinching.
here. Any discomfort in the neck?
Yeah. Not in the neck, more towards that.
Shoulder blade.
Yeah, it's
Okay.
immediately, yeah.
When I do this, any discomfort in the neck?
That's okay.
Okay. When I do this, any discomfort in the neck?
A little bit there, yes.
Okay. When I push down, any discomfort in the neck?
Slight, but not
Slight,
much. Yeah.
okay. When I do this, any discomfort in the neck?
No, that's fine.
Okay. When I do that, any discomfort in the neck?
Yeah, that's quite a lot
Is it
down there.
pinching?
Yes.
Yeah? Okay.
Yes.
When I push down, any discomfort in the neck?
Just towards that end range there on the right side.
You feel it referring down?
Yes.
Yeah?
Kind of like it's going down my arm.
Into the arm as well. Okay.
Yeah.
So this is very interesting. It ties back in with the neurologic examination that we did in the beginning. When a patient experiences weakness at a certain level, and when I do my diagnostic testing, when I'm assessing a particular area, or my orthopedic testing rather, I can trace back the potential area of injury to the area of deficit. So wrist extension, finger extension, C6, C7, the area of discomfort that Juandre is having is towards the bottom of the scapula. That's generally where nerve irritation from the nerve root at C6, C7 refers down to. And our orthopedic examination triggers those symptoms down the shoulder blade. So more or less now we have an idea of where the irritation is coming from. But we're going to continue to examine him. We still need to look at the shoulder, okay?
Great, sounds good.
Let's get you to lift this up for me. I want you to hold. I'm going to push forward. You're going to resist.
Okay.
And rest. Okay, lift up. Hold for me. I'm going to push forward. I want you to resist. Great. This side. Okay. I'm going to push forward. I want you to resist.
Sure.
Okay. Let's just double check that, okay?
Sure.
Hold for me. I want you to resist. Hold, hold, hold. So you can feel that I'm pushing quite hard here, eh?
Yes.
Yeah? Okay, let's do it on this side. Hold for me. So you can feel that it's a little bit weaker, right?
Absolutely.
Hold for me. I'm going to push forward.
Oh, yeah, that feels very weak.
Yeah?
Yeah.
Okay.
It's like the muscles are completely switched off almost.
Let's get you to lie on your back for me, please.
Sure.
Can you turn your wrist in for me, please? Push
Sure.
towards your hip. Good. Push across for me. Good. Relax. Let's have a look here.
Sure.
Push towards your hip. So this is your lat. That's pretty good. Lift up for me. Turn your wrist in. Hold. This is your pec. Let's see. Not bad at all. Okay, let's get you to sit for me.
Okay.
Swing your legs over. All right, let's get both your arms forward for me. You can start at the bottom.
Okay.
Okay, and you can work your way up for me. Lift up.
Sure.
Any discomfort in the shoulder?
That's okay. No.
Nothing. Okay,
Nothing
down
there,
for
no.
me, please. Let's do the left shoulder first. Can you lift up for me? As far as you can go. Any discomfort?
That's okay. No. A little bit tight, but that's fine.
To the side for me and lift up. High as you can go. Any discomfort?
No, that's okay.
Okay.
That's perfect.
Some
Yeah.
impingement test. Leave your arm loose for me. Any pain in the shoulder?
That's fine.
That's fine. Okay, relax. Let's try this side. Any pain in the shoulder here?
No, that's fine.
That's fine?
That's fine.
Okay, great.
Yeah.
Okay, let's get you on your back. We'll continue examining your spine.
Okay.
Just hold. Okay, and resist. So here we're testing your quads and relax. Let's do the opposite side.
You've gotten stronger, dog. Okay? All that gym is paying
I'm trying. Hold for me, please. And resist. Good. Okay, while we're here, turn your foot out. I'm going to push down, resist. Good. That's your psoas. Let's try this side. Lift for me. Turn your foot out and resist. Good. Okay. All right. Push your leg in for me. Good. Relax. Bend. Keep it in this position. Push across. Push in. Yep.
Oh, in.
Go.
Okay, sorry. Yep.
That's your adductor magnus.
Okay.
Okay, same thing here. So we're testing adductor longus gracilis. Push in for me. Okay, and rest. Okay. Push in now. Good. And relax. Okay. Okay.
Nice and comfy.
Nice and comfy. This is a new bed. This is a special chiropractic table. It's for spinal decompression. So we're probably going to try a little bit of decompression on your neck today.
Okay.
Okay, so let's have a look here. You got a slight short leg on the right side. Let's get you to raise your right leg for me, please. And down, left leg. Okay, relax. Let's go with the right leg again. High as you can go. Okay, and down, left leg. All right, so what we're looking at here, more than likely, is when a patient does a passive hip extension test, the leg that is unable to lift higher or the highest is generally indicates a dysfunction at L5. So let's have a look here. Any sensitivity when I push there?
That's okay.
It's okay. Any sensitivity when I push here?
That's okay.
Any sensitivity here?
That's okay.
All right. Any sensitivity here?
No, that's fine.
Any sensitivity here?
That's fine.
That's fine. Okay. So the good news is that it's not causing you any discomfort or pain at the moment. Any sensitivity when I push on here?
That's okay.
That's okay. And here? Fine?
That's fine.
All right. Let's have a look at your mid back. Any sensitivity there?
That feels fine, Doc.
It's not moving as well as it probably should. Here you're a little bit more mobile. Here a bit. Here you're quite jammed. Okay, let's have a look here. Any sensitivity there?
That feels fine.
You feel the difference in movement? Here it's quite hard.
Yeah.
Here you have a little bit of play.
Yes. There's some
Here not so much.
Yeah.
Okay.
Bit more relaxed.
Any sensitivity?
That feels fine.
Here,
That's okay.
here,
A little bit more.
a little more. Here,
Yeah, that's a little bit more as well.
and here. How's that?
That feels okay.
That's fine.
Yeah, it's just a
Okay, so you have some sensitivity at C4, 5. Okay, guys, so we've assessed Juandre. We've done a full spinal assessment. We've assessed his shoulder. On orthopedic examination of the shoulder, there's nothing really going on there. His impingement tests are negative. His shoulder strength is good. Beside for his scapular stabilizers, his rhomboid minor and major, and his trap, med, and min. This just so happens to be along the pathway of nerve irritation from the level C5-6, C6-7, even C4-5. C4-5 generally refers to the upper trap, C5-6 to the middle, and then C6, C7 to the bottom. He has some sensitivity at C4-5, so I think he probably has something happening at one or two of those levels in his neck. This is very common with weightlifters, gymmers, athletes, rugby players. They're often running headfirst into people or things. So we can expect an injury at that level. So what we're going to do today is focus on the neck, do some spinal decompression, some intramuscular electro-stimulation to stabilize the neck, offload that segment, work the trap, med, and min, the dorsal scapular nerve to decrease the sensitivity going through this region, and end with some spinal manipulation. All right, guys, remember, if you like what you're seeing, please hit the like button. If you have any questions on neck pain, shoulder pain, or spinal pain, please drop them in the comment section below. All right, let's get going.
Lovely. Sounds good.
Okay. Lift your chin for me slightly. Lift, lift, lift. No, not your head, just your chin.
Oh, sorry.
Lift it up. There we go. Just a little bit. Drop it down a little bit more. There we go. I just want the strap to hold on to the base of your neck. Okay. Let's get this up. Okay. Okay guys, so you've probably seen me do spinal decompression on the lower back before. You haven't seen me do it on the neck. This is how I would perform spinal decompression on a patient presenting with a cervical disc displacement or cervical spondylosis, often referred to as degenerative disc disease. All right, you ready to go, man? Okay. Inhale and exhale. 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 And relax. How does that feel?
That felt really good.
So for those of you who are new to my videos, this is a neural impulse adjuster. What it does is it delivers the same force that a spinal manipulation would provide to a patient's spine. The reason why I use it is because I prefer to couple therapies. I believe that it has a better effect in treating a patient's injury. While I'm decompressing the spine, I also want to improve the perception of time and space of the joints, which is one of the effects of spinal manipulation. And I can do that by using this manipulation device. What that will do is it will encourage the tiny receptors in the facet joint, which is the joint we manipulate as chiropractors, to stimulate the nerves in that area, to fire up the muscles stabilizing the spine, and to reduce pain. And then I will couple that with my intramuscular electro-stimulation and couple that with spinal manipulation. So the more things I can do that have the same effects, the better the effectiveness of treatment when managing a patient.
Nice.
All right. Inhale and exhale. 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 And relax. Okay, last round.
Okay.
Inhale and exhale. 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 And relax. What did that feel like? The decompression.
It felt really good. I could just feel like everything's just loosening up and lengthening.
Yeah.
So,
You feel it
yeah.
stretching on the disc.
Absolutely.
Okay.
Absolutely. It felt so good. I got a relief.
All right. So we'll do our intramuscular electro-stimulation first of the neck, and then we'll move into the shoulder blade.
So much better because they can control like the movement a lot better. Like I can run straighter lines. In rugby, you get tackles from left, right, centre, back, anywhere you might not see your blind spots. It's so risky. So I really love the cricket out here. It's so good.
Did your career end because of a particular injury or?
Yes, the ACL.
Ah, okay.
Right knee, yeah. So I tore that and I did my rehab, got better, felt strong, and then I tore it
A second time?
the second time, three months later.
Okay.
And then that was it. The knee just never was the same.
3 months after coming back? Or
Yes,
three
after
months?
The rehab. Yeah,
Okay.
after the rehab. The rehab was about 9 months,
Okay.
which I heard the treatments nowadays even faster.
Yep.
Was it Sia Khaleesi who tore his ACL?
Yeah. He was back in 6 months, right?
Unbelievable.
Before both World Cups.
That's it.
Right?
Yeah. Unbelievable. The treatments are getting so good.
Even Peter Steph Dutoy, right?
That's right.
He had quite a fast recovery.
Yes,
But
that's it.
they used, from what I believe, they used ACL from his dad.
That's correct.
Yeah.
Yeah, his dad was the donor, yeah.
But-
Unbelievable.
I guess for athletes, for professional athletes, it's absolutely essential. But I think some of the research coming out now is actually saying that there is no difference between surgical intervention and conservative therapy and management in outcome measures.
Okay.
So that essentially means that you don't necessarily need an ACL reconstruction. In my opinion, I think the effectiveness of the exercise rehab
Yes.
makes the biggest difference, right?
Can't agree more.
Yeah. All right. So we're going to switch this on. Can you feel that?
Yes, there's a pulse at the top.
Yeah. Light, mild, or strong?
Mild.
Can we leave that there? Or would you like me to increase?
We can go a little bit more.
How's that?
Yeah, that's good.
Okay.
That's perfect, yeah.
Okay, so for those of you who are watching my channel for the first time, I will explain intramuscular electro-stimulation to you. Juandre has undergone this treatment before, so he's well aware of what it does. Intramuscular electro-stimulation uses a frequency of electro-stimulation called TENS, transcutaneous electrical nerve stimulation. And this frequency is at the same level at which the brain perceives pain inhibition and muscle stimulation. So what am I trying to do here? After the discs are decompressed, they're going to start to draw in water and hydration, or water for hydration. And that hydration is going to allow them to become healthier and heal themselves. However, when Juandre stands, the weight of the head on the neck with gravity can cause that vacuum we create during decompression to stop. Once it stops, the healing process stops. So what I want to do is fire up the muscles that are stabilizing the discs and the spine so that the vacuum and pumping mechanism we create during decompression is more effective and more long lasting. At the same time, where the needles are passing is very close to where branches from the nerve roots are passing. They call the medial branch of the posterior spinal nerve. And those nerves give feedback, in particular pain, to the nerve root and the spinal cord. So what we want to do is subdue those nerves. Even though he's not experiencing too much of neck pain, what pain can do is create inhibition or muscle inhibition. And that is the problem here. With the lack of stability of the neck, you're going to have compression of the nerve root, which is going to refer pain into the shoulder, especially when Juandre fatigues, like when he's playing cricket or a long cricket match. So as you can see, pain and muscle strength are very closely related. And again, You'll hear me say the same things over and over. Coupling therapies having an effect on pain, muscle inhibition. It's because I think these two things are fundamental in managing a patient's case, especially in the initial stage of treatment. All right, you good, man?
Excellent. Yeah.
So you got 3 minutes to go. Can I increase the time? Can I increase the intensity?
Sure. You can a little bit more. Sure.
How's that?
That's okay.
All right. So what I'm just doing is, it's a bit difficult with the cables here. I'm just having an observation of the back.
Okay.
Feels quite sensitive in here.
It does actually. Yeah, right down that spot.
Yeah. All right. So when the cable's off, we'll come back and I'll just show the camera what's happening here with nerve sensitivity over a period of time. You good? You just have 2 minutes to go.
Perfect.
Great.
Good. It's nice to hear the thorough explanation so I can understand what's going on as well. That's great.
You know, what I find is, as a patient, I often get the impression that a therapist doesn't know because they're not explaining. Or even if they know without any explanation, you as a patient, you don't really know what's going on.
Yes.
A lot of patients come in having been to several therapists.
Yes.
They don't really know what their problem is. They're not given a diagnosis. They're not given an explanation.
Yes.
And that's what I prefer to do. I prefer to explain to the patient what I'm doing, what the issue is first of all,
Yes.
how we're going to treat it,
Yes.
and I prefer to explain to the patient during therapy how I'm actually managing them so you understand.
Absolutely.
Sometimes patients get frustrated about lack of progress,
Yes.
but if you understand what we are doing and if you understand your injury, it makes it easier to understand and accept that certain things take time.
Yeah.
And progress is only measured after a series of sessions.
That's correct. Yeah, for sure. Yeah, just managing the expectation of
Yes.
what's going to be expected and how long it might take. Fully agree. That's
It's
great.
it's one of the reasons why I like to use imaging. So for those of you who watch my channel, Juandre's wife is Juliana. For those of you who have not seen that video, please go check it out. Juliana is a perfect example of how we were able to match her symptoms and her examination to an image and then manage her more effectively.
Yeah.
And according to Juandre, I haven't seen her in a while. She's doing much, much better.
Absolutely. So much better.
And that was one of the issues in Juliana's case, is that the diagnosis was missing. The symptoms were being treated for a period of time.
Yeah.
Her pain was being managed, but there was no diagnostic given. There was no answer of what is causing her shoulder and neck pain.
Exactly. Yeah. No, she's doing so well. Absolutely. That's so.
All right, so that just ended. Let's get these out. Okay, so a lot of patients come in and they talk about tightness between the shoulder blades. And I'm going to come back to what we did in the beginning of our session, which was our neurologic examination. Tightness here in the shoulder blade can come from a few areas. It can come from nerve irritation in the neck. It can come from a lack of mobility in the mid-back. It can come from the costotransverse joints or the rib heads, which may be out of alignment. Now, during our examination, we're obviously trying to eliminate some of these potential areas of injury from least likely to most likely. Now, when we start with the neurologic examination, it helps us to tie things in. Now, when you have nerve sensitivity, what happens is the muscles tend to go into a guarding reflex. So most therapists say to patients, you have a trigger point, you have a muscle spasm. We know now that it's not just a muscle spasm. Why? Because we did our neurologic testing. So if you come over here and you have a look, if we palpate the trap muscle from the inferior aspect here and we go up, we can feel that there's a bit of tightness here, okay?
Yeah.
I think Juandre will acknowledge that it is quite tight. So this is your trap median, and underneath that is going to be your trapment. You can see there's a nice juicy trigger point here. But if we come over to the opposite side and we start to have a bit of a poke and prod, now all of a sudden it is much harder, it's much more ropey, okay? That definitely feels different, correct?
Absolutely.
Yeah?
So much harder, yeah.
Okay. You can feel that in there, very hard and tight. And this is what I believe is one of the big things what patients are mistaken by is muscle tightness. It's important to get an idea as to why the muscle tightness is there. When we assess his mid-back, his range of motion is excellent. For a guy this big with this amount of muscle, he can rotate fully. He can laterally flex. He can flex and extend. So this is a great example for us, okay? So these muscles most certainly need to be released with some soft tissue, but in a first session for a patient, I mean, this is not Juandre's first session, he's been here before. It's been a while since we've seen him though. So we'll call it our first session, right? Yes. What I prefer to do is use my intramuscular electro-stimulation to desensitize. What I feel that does is it causes the muscle to relax, okay? By desensitizing the nerve, we can then work more effectively on the muscle. When a nerve is sensitive, it's going to cause the muscle to tighten. When you then go in and you push and prod on that muscle, you're going to irritate the nerve because it's not switched off, it's not desensitized. That causes the muscle to go back into a guarding reflex. So most patients who go to therapy and get this released all the time, you will know that after a while, the sensitivity comes back, right?
That's
How many times have you had that area released?
Yep, 100% all the time. That's true.
So, there we go. We're going to do the trap min here. It's always nice working with bodybuilders because you can feel where the muscles are.
Oh,
You good?
Pulsing hard.
Yeah.
Good, yeah.
You good, man?
All good, yeah.
So I see you've also been shooting a lot of content.
I am. I'm trying my best, yeah.
Well done, man.
Thank you so much, yeah. To progress and scale up.
Yeah.
I've got to put in some hard work, yeah. It takes a lot of time and it's a lot of effort, but it's needed. You got to do it to get the reach.
You do.
But it's paying off. It's paying off.
You kind of look like Noel Dasel's twin. He's better looking brother. Let's get you to lift the shoulder there for me, please.
Actually, I've got that a few times now.
Yeah, you have?
Yeah.
There we go. All right, leave that. Can you leave that shoulder? There we go. Okay. So no stress. This is probably an awkward position for your shoulder. Please bear with me.
Sure. Whatever's needed.
There we go. You good?
All good. Oh, that was a strong one. That's good.
All right, let's get that from you.
Sure.
Oh, there we go.
Yeah, that was responsive.
So, you guys out there that often wonder why you have tight traps. Is it postural related? Is it because you're sitting at a desk all the time? Yep. But just in front of the trap, you have a small nerve called the supraclavicular nerve. Too strong?
That's fine, Doc. No worries.
You sure?
Yeah, that's fine.
I think this one's better. Just in front of the trap, you have a small nerve called the supraclavicular nerve. And when the trap gets tight, it compresses on that nerve. The tighter the trap gets, the more sensitive the nerve gets. So again, when you release that trap, when you try to stretch that trap, it's effective for a period of time, but it's the sensitivity of the nerve that's keeping you in that cycle.
No.
So that's what we're working on here.
The majority of people keep their tension in their traps.
Yep.
Then we just go to trap and
I don't normally use a 4 centimeter needle for that muscle, man. Now these traps, be trapping.
Let's
you
make
know?
it a 10 centimeters now.
So you do want to compete?
I'd like to, for sure.
Yeah.
I think when the time's right,
It does take a lot of effort, man.
it
Oh.
does. It does. But I think the systems I'm using now is working really well. But I need to bring up.
You've also tightened up a little bit.
Yeah.
Yeah?
Yeah. I did an aggressive bulk, which is just I put on way too much body fat, so just changed up things a bit more. Keeping the calories just slightly in a surplus, not as much as before, and it's working
And
well.
you're doing a lot of, you're doing like cardio daily to try and keep the body fat off?
Just no, purely for heart health.
Yeah?
I'm just doing 20 minutes,
Okay.
low intensity, yeah. And I'm doing like cricket twice a week, so that's like my high intensity
Okay.
sort of work, so that's fine. Yeah.
I saw you made a century recently.
I did,
Yeah?
It's been a good season.
Yeah, nice.
So far so
Nice.
good, yeah.
You playing in the Dubai Super League?
And the
No, Desert Super League.
yes.
Is that what it's called?
Correct, yeah.
Yeah.
DSL,
DSL, yes.
correct. There's a few others that we
Let's get you to sit for me, please. You're going to face this way. All right. You good?
all perfect, yeah.
All right.
Good.
Let's get you to look up now for me, high as you can go. Any sensitivity running down here? No? Look straight ahead for me. Turn over your right shoulder. Look over your right shoulder for me as far as you can go. Any sensitivity in here?
No, that's fine.
No? Look straight ahead for me. Can you bend your left ear to your left shoulder? How does that feel?
Much better.
Yeah. Can you bend your right ear to your right shoulder? Go for me.
Just
There we go. Just
yeah.
at the end.
Just at the end. right?
Okay.
Yes.
So let's do some muscle testing. Let's lift this up for me, please. Hold. I'm going to push forward. I want you to resist for me. Let's go. There we go. Go. Much better. Okay.
Stronger.
Lift up. Hold for me. I'm going to push forward. Resist. Go. There we go. All right. Okay.
Because it actually switched on now.
Yes, they are indeed. All right. Let's get you on your side again for me, please.
Sure.
Come across for me a little bit. There we go. Okay. Leave your arm loose. All right. So what we're going to do is we're going to mobilize the shoulder blades. So what happens in patients who have this nerve sensitivity, when these muscles shut down, the scapula stops working as it should. Now, Juandre is bowling medium pace, right?
Yeah, I'm trying to get fast.
He's trying to get fast. Okay, so what happens is when those scapular muscles shut down, or scapular stabilizing muscles shut down, the scapula does not function as it should, and the glenohumeral joint takes more of the strain in the bowling action. So what's going to happen is it's going to load his rotator cuff and start giving him pain in the shoulder. So what I like doing is just mobilizing the shoulder blade just so that it can again learn where it is in time and space, so that it can start taking over from the glenohumeral joint a little bit.
Nice.
All right, let's take a small break. Let's go again. There we go. Okay, let's get you to sit for me, please.
Sure.
I'm gonna face that way.
Okay.
All right. Okay, can you bend your neck to the right for me again? Any sensitivity now?
Definitely less.
Yeah?
Way less, yeah.
All right.
It was like a 8 at this end range.
Yeah.
It's probably a 1, 2 now.
Okay, great. All right, so one of the other reasons why I like to mobilize the shoulder blade is because the levator scapulae attaches to the shoulder blade. This is a very, very tight muscle in patients with lower back, with neck pain, excuse me. It becomes hypertonic when it's not exercised and when it's overloaded, and mobilizing the scapula helps to give some feedback to the muscle, which can at least allow it to settle down a little bit. All right, so shall we get into some manipulation?
Sure thing.
I think so. All right. Okay, let's get you to bring your right hand up for me, please, under your hip. Under your hip. Okay. Let's get you to turn your head to the left for me, please. There we go. Oh, there we go. Inhale. Exhale all the way out. There we go. Great. Okay. Face down for me, please. Let's get your hand back to neutral. Okay. Now, you feel the difference now?
Yeah, it's
Much more springy.
more springy. Yeah.
Okay. Okay. Let's get you to sit for me, please. We'll adjust your mid back. Bring my trusty board here. Let's get you on your back for me, please. Okay. What's your weight now?
107.
107, okay.
I said 108.
Well.
But yeah.
I'm currently 84, so this is going to be a challenge.
You got
Let's
this.
go, let's go.
I believe in you, Doc.
Lift your head for me, please. Okay. Inhale, exhale. There we go. Inhale, exhale. Inhale, exhale. Okay, drop your head back for me. Keep your arms crossed. Bend your knees for me, please. Okay. Inhale, exhale all the way out. Oh, you good?
Good.
That's a bit tight there.
Yeah.
Okay. Let's bring your hips to the edge for me, please. There we go. Bend this here. Bend, 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 bend. Okay. Let's see. Give me this hand. Let's pull through. Okay. Inhale. Ooh. There we go. Exhale. Okay. Let's get you to turn the other way for me, please. That was one on. That went on setup. You good?
Yeah, literally just as that said,
Yeah.
That's great.
There we go. Let's get you to bend this for me. Yo, your hip mobility is lacking a little bit
Is
there.
it?
Yeah.
Point them out. I'll work on it.
Okay. Let's get this leg straight here.
Okay.
Place that there. Give me this arm. Let's pull you through. Okay, look up for me, please. Give me this arm. There we go. Let this hip roll now. Roll, roll, roll. Roll. Oh, there we go. Inhale. Exhale. Oh, guys, that just went on setup.
Yeah, literally.
Yeah. Okay. On your back for me.
The hips are a bit tight.
Yep.
Okay.
You can relax, relax. We're just going to adjust your neck.
Okay.
Keep your knees bent. Bend your knees for me, please. Okay, let's see. Inhale, exhale. There we go. That didn't require much.
Literally nothing.
Let's get you to sit for me. Okay, let's just reassess your leg length. You can lie face down for me, please. You good?
Perfect.
Okay, let's have a look here. Relax, relax. There we go. All right. Leg length is great. Let's get you to raise your right leg from your hip for me. Fantastic. And down. Left leg. Up, up, up.
That feels
Okay.
like it's way more range.
Way more range.
Yeah, I can do that.
Yeah. All right. Let's get you to sit, man. Okay, guys, that brings an end to our session today. That is more or less how we would work with a patient like Juandre for this particular type of injury. We'll see him in a couple of weeks, probably reassess him, continue some work on the neck and mid-back, and have a look at any other areas that he has an issue with. Okay, so if you want a body like this, yeah, please tell our clients where they can find you so that they can get into some summer shape.
Thanks so much, Doc. Yeah, Juandre Kruger Fitness on Instagram.
Yeah.
TikTok as well. If you you use TikTok, so yeah.
Okay,
Check it
so
out. Thanks,
we'll
Doc.
drop Juandre's links in. We'll drop Juandre's links below. Please have a look at his social media. Guys, remember, like, subscribe, hit the notification button. We'll see you soon. Take care.
Thank you, Doc.
Thanks, brother.
Amazing. That was great.